my name is Kristen Lee, and today I'll be presenting on the global impact of sepsis. So a little bit about me, I'm a rising junior in Johns Creek, Georgia, attending Chattahoochee High School. Some of my extracurriculars are below, and as for my career goal, I'm interested in medical research or healthcare as my lifelong aspiration. It was actually through my passion for research that I became interested in the topic of sepsis as I was exploring different natural compounds as potential cost-effective treatments, which I am continuing to this day. In this presentation, I'll be discussing what sepsis is, why it's an important issue, and some of the challenges concerning sepsis. So what is sepsis? The World Health Organization defines sepsis as a condition that occurs when the body's immune system is compromised and ends up harming itself due to an infection, most commonly one that is bacterial. Although sepsis can occur from any type of infection, not all infections are guaranteed to cause sepsis. In the case of a sepsis patient, when an infection occurs, the immune system goes into overdrive, launching what is known as a cytokine storm. This is when leukocyte-recruiting proteins known as cytokines trigger an excessive pro-inflammatory immune cell response, causing a positive feedback loop leading to hyperinflammation, vessel damage, and eventually organ failure. Normally, the body has measures to control the immune responses. However, in sepsis, these control measures are overwhelmed or impaired. Sepsis also leads to the increased release of vasodilators in the blood vessels, leading to increased heart rate, lowered blood pressure, and rapid breathing, all of which are trademark signs of sepsis. As you can see, the symptoms of sepsis, such as fever and pain, are very ambiguous and common medical symptoms, making sepsis often very hard to identify, easy to neglect, and all the more dangerous. Early recognition of sepsis is crucial in a patient's chances of survival as it worsens over time. After infection, sepsis occurs in 3 stages based on severity. The first stage, sepsis, which is sometimes considered a subcategory of infectious SIRS, is marked by high heart rate, abnormal body temperature, and abnormal white blood cell count. From then, sepsis progresses to severe sepsis, in which changes in blood pressure or blood flow occur followed by organ dysfunction. This leads to several signs which signify the second stage of sepsis. The last and most severe stage of sepsis is septic shock. This is where organs begin failing, which can lead to death or lifelong disability. Typically, patients that reach this stage face a mortality rate of 30 to 50% and have a window as little as 12 hours even with treatment. In terms of vulnerability, people who are over the age of 65 or children within a few years old have a higher chance of getting sepsis after an infection. This also applies to women who are pregnant and people who are either chronically ill or have a weakened immune system. For people over the age of 65, the risk of getting sepsis increases with age. Now, why is sepsis such a big problem? Sepsis is a very prominent and concerning global issue that affects and kills millions of people worldwide each year. It is so common that 1 in every 3 patients who die in the hospital will have sepsis. With an estimated mortality rate of 30 to 50%, it is one of the leading causes of hospital deaths and hospitalization. On a global scale, sepsis affects nearly 49 million people and kills nearly 11 million each year, making sepsis at least partly responsible for 1 in every 5 worldwide deaths. Aside from its health impact, however, there are a few factors that make sepsis particularly relevant and significant on a global scale. First is the cost of sepsis. Sepsis is a very expensive and costly condition that takes a major financial toll on families and patients, as well as the global healthcare industry. Part of the reason why sepsis is so expensive is because patients with this condition often stay 75% longer in the ICU than most other patients do. With sepsis being such a common and prevalent issue, it is imperative that we work towards innovating cost-effective solutions so that it is not burdensome or as costly. The second challenge with sepsis is diagnosis and treatment is our current limited data on it. Although most worldwide sepsis cases occur in middle to low-income countries, with some of the highest incidence and death rates occurring in Africa, the World Health Organization states that most published studies in sepsis have only been conducted in high-income countries. Without a sufficient understanding of places where the majority of sepsis cases occur, fully addressing the problem of sepsis is impossible. Thus, places in which sepsis treatment and/or research may be more difficult or lacking should be a priority in the field of global health, given how deadly and widespread sepsis is. The third obstacle associated with sepsis is inconsistency in diagnosis and treatment. According to the World Health Organization, different definitions and criteria make it difficult to truly understand the global implications of sepsis. Despite continuous efforts to establish a universal sepsis procedure, sepsis diagnosis and treatment continues to vary significantly from hospital to hospital, contributing to 1 in every 5 sepsis cases being misdiagnosed or delayed. With time being of the essence for sepsis patients, inconsistent guidelines for sepsis can mean the difference between life and death. Finally, lack of awareness of sepsis is a major issue that impedes diagnosis and treatment. According to the Sepsis Alliance, only 12% of Americans can identify the most common symptoms of sepsis. What makes this more concerning is that most sepsis cases arise from within the community, where it is up to family, caretakers, and the patients themselves to seek medical attention for this potentially life-threatening condition. This makes discovering and diagnosing sepsis more difficult and significantly delays patients' hospitalization and treatment. With sepsis being such a prevalent issue, it is critical that we expand our efforts in mitigating its global impact. To reduce the impact of sepsis, there are two key things we need to improve: early action in sepsis and the rate of mortality. Working on these to reduce the number of serious cases will not only alleviate the cost of sepsis, but will also mitigate its health consequences. As sepsis occurs from infections, the best way to prevent sepsis is to prevent an infection. Healthy hygiene measures and good sanitation are ways to lower the chances of getting an infection and getting sepsis. This is especially important for infants and the elderly, for whom the chances of getting sepsis are higher. The second measure of reducing incidence and reducing the number of fatal cases is raising awareness about sepsis. Raising awareness not only leads to more timely diagnosis and hospitalization, but can also support research and fundraising for sepsis in those who are affected. With the large number of sepsis cases worldwide, it is important that we continue to improve the consistency, accuracy, and speed with which we identify and diagnose sepsis. By improving diagnosis, we can catch sepsis earlier on and significantly raise a patient's chances of survival. Finally, understanding how sepsis affects different people across the world is essential to tackling this global issue. By collaborating with others on an international scale, scientists, researchers, and healthcare professionals can refine sepsis treatment to save more lives and reduce the mortality of sepsis. The key takeaway I would like from this presentation is for you to understand the dangers and impact of sepsis and how we can work towards overcoming it. On that note, one last thing I would like to mention is World Sepsis Day, which is every year on September 13th and is dedicated to raising awareness on the issue of sepsis. If you found this presentation interesting, I encourage you to learn more about World Sepsis Day and the Sepsis Alliance. Thank you to the Global Health Leadership Conference for this amazing program, as well as for the amazing opportunity to speak in the Student Speaker Series. Last but not least, thank you for listening to my presentation on the global impact of sepsis. Please feel free to reach out to me through my contacts below. Again, thank you and have a nice day.